Good evening, everyone, and welcome to our Thursday evening workshop. As you asked, what is the most value of for you? And one of the big percentage, maybe 34 or 5% of you said understanding what is behind GI or gut symptoms. So we started last week with bloating, and today is very important one, and so very important that I had to do a couple of them. Let me just see if I can see who is here present. Will be nice. As you know, I like to greet people by names. I don't see yes. So give me a thumbs up or heart, then I will know who is here. So what is behind really acid reflux and GERD or silent reflux? We will be learning today a lot. For many of you, especially for newer members, it might be shocking. And I got a heart and I can't see from whom. Oh my. I figure out, hopefully. Because if you follow me for a while, you know I frequently talk about this topic because it's very, very important, guys. Because when we don't have good digestion, we cannot have good health. That's it, period, end of story. And of course, okay. But before we start, you know, guys, the disclaimer, this presentation is only information for educational purposes. This is not a medical advice, and this cannot replace the care of your healthcare provider. So if you need help, you have to reach out to them. Healthcare provider, functional medicine practitioners. Hi, Monica, I see you now. So great to see you. And I see more people joined. So hopefully I can see everyone here. So such a pleasure always to spend this time with you guys. So this is just information to educate you, to inspire and empower you. Because when we know better, we do better. That's the motto I live by. I walk this path of healing, gut healing, and not having any support it was a very bumpy road, very frustrating. Many times I wanted to give up on myself, seriously, guys. So that is, if I knew all this information I have now, will be so much easier. Let's get rolling. If you don't know me by now, let me introduce myself. I am Ilona Berkoven. My name is Ilona Berkoven. Yes, I'm a real MD. I've frequently been asked, are you a real MD? Yes, I am. So I used to practice medicine, and I like to say, which is true, guys. I studied medicine more than 40 years. So I think I accumulated some knowledge, but of course, um, there is always room for more. Especially now, the functional medicine is advancing so beautifully, and so much new breakthroughs are coming out. So we still have to learn. And of course, that for me is not anything difficult. I'm a lifelong learning. I like to joke that on my deathbed, I will probably read something about newest research on microbiome. So when I don't work, but work is not even work for me, guys, and I'm not kidding you. I love what I do. I can't tell you, I can't even put into words exactly how I feel when I talk to my people, talk to my clients. My soul feel and heart feels so full. Seriously, guys, I just love it. Love it, love it. I think one of the biggest blessings in everyone's life is to do what they really like, what they're passionate about. So when I don't work, let me call it work, I like to forage, and you usually see springtime. Springtime is best season for foragers, with herbs and plants and mushrooms, more my husband, but I really like plants. I'm learning a lot about them. So, hi, Alita, welcome, welcome. So great to have you. And two more people present. If you say something, I will know you. and I like to travel and meet interesting cultures and people. And that is, I'm so happy to have in our community people from basically every continent. So beautiful. Let's get rolling. Acid reflux. So intention is to learn what is really reflux, what causing it, why is it so important, guys, and why it's not a good idea to mask the symptoms. One is, for example, frequently H. pylori overgrowth can be totally missed, right? We will get to that, to the details. So the very well-known burning pain behind the upper abdomen and behind the chest bone. Now the pain can be located there. It can go all the way up to the throat, sometimes even into shoulders. Between the shoulder blades is different for everyone. And also we will address a little bit the silent reflux that can be tricky. And I will tell you a couple of scenarios with my client or even in my family member. So what are the symptoms? That burning pain, usually, sometimes pressure-like pain. And guys, let me be clear. It can be very frustrating because it can mimic perfectly heart attack. I remember when I used to work in ER, and people will come with that burning chest pain. And we, for example, during holidays, we knew people overate, but I will never can say, oh, just a heartburn. We have to do EKG because heart attack frequently happens after big meals. Of course, people who are predisposed, in a healthy person, of course, a healthy person will get heart attack. So it can be very tricky. And I hear from my people who struggle with, because especially at night, when we supine position, it gets worse. And they wake up, oh my gosh, is this chest pain? Is this reflux or heart attack? Shall I wake up my husband or a wife or to take me to the ER? It can be tricky. It can be really tricky, guys. So it can be coupled with nausea, bloating, a lot of belching, discomfort in upper abdomen, dry cough, bitter taste, and frequently and many times we don't connect, especially conventional medicine, a lump in the throat, sensation that you swallow a bite of food and it stays stuck in the throat, because that is one of the symptoms. And then probably people say, oh, this is just like some anxiety. Here you go, some, I don't know, sedative, you will be fine. No. Triggers. So we will be distinguishing, guys, for example, reflux during pregnancy, when the growing baby, right, pressure, the stomach and the intra-abdominal pressure increases. That's one thing. Other thing, after bigger meals, especially during holidays, we eat heavier meals, we have reflux. That's other thing. We are talking about reflux on daily basis or most of the days of the week. That is our focus. Then we know spicy food, greasy food, coffee, chocolate, energy drinks. Now, what can make worse reflux? Acidic food, of course, sugary food, lying down after eating, stress, ketchup and mustard, tomatoes, tomato sauces, mints, vinegar, yes, can trigger. Now, this is the most important part here. What are the causes? The big why. Guys, the functional medicine is a medicine of why. That is the huge difference between conventional and functional medicine. I practice conventional, so I really can compare. And I have to tell you guys, when I started studying functional medicine, I had to unlearn many things. Here is one. We were trained that heartburn equals exactly 100% too much stomach acid. That is why we prescribe acid-reducing drugs. Now, I have to tell you here, you have to understand, because sometimes people look at me in disbelief. They're coming from the GI doctors and sometimes big names. And now I'm telling them, oh, no, no, your reflux is caused by too little acid. Oh my, but my GI doctor told me it's hard, because I really don't want to talk down to any of my colleagues. But really, guys, this is very important. And here is why. When we suppress symptoms with acid-reducing drug, what happens? Yes, you feel better. Absolutely. It neutralizes the acid. But this comes at very high price, right? Because that little acid we have, we further lower the amount of the acid. And as I mentioned in the beginning, without good digestion, we can't have good health, period. That's it. So that is the big problem today. And by the way, hi Fiona, welcome, welcome. Good morning to you. Yes, good evening for us, but so great to see you. So what is happening, guys? We put people on PPIs, omeprazole, whatever, Protonix, all different kind of names, Nexium, for long period of time. And that has a lot of consequences. I have a client who was 30 plus, I think 34 years on Nexium omeprazole. She has most of the PPIs, proton pump inhibitors. Can you imagine those consequences? And my mind can't wrap around that none of the doctors ask, hey, what's going on here? Here is why. PPIs are fantastic medications. They designed for 2, at most 3 weeks of use. That's it. And the whole purpose is to calm the ulcer, create environment for healing. Because when someone has ulcer, and that ulcer is, by the way, not caused by stress that I was taught in medical school, except the huge stress, for example, massive burn. Yes, that's huge stress. It might cause, yes, no, in general, it's caused by H. pylori, Helicobacter pylori overgrowth. So what is happening? And when we have ulcer, it's raw, it's painful. So we suppress the acid and make it possible ulcer to heal. And that's it. It's not designed ever for treating indigestion. It's not designed ever to give for acid reflux for months, years, decades. Absolutely not. And I see this over and over and over again. Guys, that's wrong. Now, if you are one of those medications, remember in the beginning the disclaimer, you cannot abruptly stop them. You need help with that. There is a reason, there is a way how to do it, because the rebound reflux can be very brutal. I had clients who were so impatient that they decided to go on their own, stopping PPIs, and oh boy, then we had to go back, and they said, you see, I have to take them the rest of my life. That's not true, because there is a way very, very, very slowly and safely to do it. So low stomach acid. I preach this over and over again, guys, that I have a few graphics. The lower esophageal sphincter, that is the place when esophagus goes into stomach. The strongest stimulus to keep it closed and function well is stomach acid. Yes, when the stomach acid splashed by the stomach is churning, right? Stomach acid will splash close to the sphincter, and that's a signal to be closed. When we have low stomach acid, The sphincter gets out of control, opening when don't need it, closing when don't need it. Normally, that sphincter is closed. When is sphincter opening? When we swallow food, when we swallow liquid, belch, or throw up, vomiting. Those are the instances in a healthy person. And when the stomach opens up, when it's not supposed to, the stomach acid, that little we have, will slowly back up into the esophagus, throat, ears, lungs. We will cover that as well. So what is, so low stomach acid frequently, then the next big root cause is fermentation. And that is so very well connected, guys, because we need stomach acid to kill off the bacteria. And when we don't have enough stomach acid, what happens? Bacteria will slowly populate the small intestine. Normally, we know that in the small intestine, it's not sterile, but very close to it, very small number of bacteria. That is normal. In a healthy person, we don't have heaviness, we don't have bloating, right? And when we don't have enough stomach acid, we have a lot of partially digested food and many surviving bacteria that start feasting on those partially digested food. What happens? Fermentation, a lot of gases. And guys, this can be unpleasant, but can have a lot of consequences as well. So welcome, welcome everyone. I see people joining. Come on in. And at the end, guys, feel free to ask questions. I will be coming and check the question, scrolling through. So fermentation, we have to understand, guys, stomach acid has a lot of function beside the digestion. And it's so well connected, stomach, pancreas, and gallbladder. Yes. When we don't have stomach acid, the gallbladder and pancreas also get lost, like a sort of day brain fog, because they need that big yell, loud speaking from the stomach, hey, food is coming, get ready. And when they don't have that, just a tiny whisper, it's not working well. So when you see the commercial for EPI, exocrine pancreatic insufficiency, people just like those abbreviations. It's so scientific, so in, right? But no one is mentioning why. So the next fermentation is dysbiosis, which is, so fermentation dysbiosis. Dysbiosis is imbalance of the microbiome. SIBO in the small intestine, dysbiosis, large intestine. So low magnesium. Magnesium is also very important for the function of the LES, the lower esophageal sphincter. And of course, so many of us are low on magnesium because of low stomach acid. Yes, we need stomach acid to strip off all the minerals from the food. Plus, the food we eat is not the highest quality, even when we think it, meaning the nutrient content is less because of the modern farming practices. So low magnesium, then huge meals. Of course, it will open up the pressure, we open up the sphincter. Carbohydrate indigestion, which is fermentation, and increased abdominal pressure, which is fermentation as well. So GERD. What is the GERD? The GERD is a more severe form of reflux when we really have repeatedly, day in, day out, backing up acid into the esophagus. So sometimes even food can regurgitate. People can have difficulty swallowing, chest pain, wheezing, coughing. That happens when the stomach acid backs into the lungs. Now, guys, don't think that half a cup of stomach acid, a microscopic drop, when gets to the airways react, right? Because we have to remember stomach acid is one of the strongest biologic acid. When you will drop on your palm, you will have deep burn from the acid. So that is how our body is so perfectly designed. Normally, we don't feel stomach acid in the stomach unless there is erosion or ulceration. The stomach is designed to work with the acid, with very strong acid, and they have thick layers of mucosa, has mucus, yes, and that is why we don't feel acid. We feel acid when it's going outside of the stomach because, for example, the esophagus that is not designed to deal with acid. That is why we feel the pain, or the inner ear, or the throat. So another very important aspect is silent reflux or pharyngeal reflux. So stomach, guys, I always make mistakes. Usually I do my slides 3 or 4 a.m., so forgive me for that. So stomach acid flows backward, but typical symptoms are absent. So for example, someone can have frequent sore throats. You go to your doctor, they do the swab, thinking maybe strep throat and don't find anything. Or a frequent hoarseness in the morning, but later on, as the day is progressing, your voice is clear again. Or especially clearing the throat in the morning, right? Or feeling you always have to cough. Other changes in the clarity of the voice, and people wonder, they go, this is happening frequently. They go to doctor, let's see, family practitioner, a general practitioner, other countries. They will be sent to ENT, and when the ENT is into functional medicine and see the redness, see the irritation, they might say, okay, it might be reflux. And luckily, I heard from people more and more they're going into that group, so which is great, really great. So again, I mentioned that bolus type, like you can't swallow, the food stays in your throat, underneath, just between the throat and stomach halfway. That can be very typical of silent reflux. I had a client who had just that symptom, and everyone called her, it's her nerves, so she needs to calm down, she needs to take some sedatives. She had no burning, nothing. And frequent earaches. Again, you go to ENT, ear, nose, and throat specialist, and they see something, they can figure out what's going on. Always think of silent reflux. Now, this is big, guys. H. pylori. H. pylori, Helicobacter pylori, overgrowth. When Helicobacter pylori is present under the limit, the cutoff limit, and the person has no symptoms, usually we don't treat. Now, when the H. pylori is overgrowth, even without symptoms, we treat. When H. pylori has even under the cutoff value, but has virulence factors, we treat. Now, H. pylori causes frequently chronic gastritis, stomach or duodenal ulcer erosion that lead to ulcer, nutrient deficiency, dysbiosis, SIBO, and many extra intestinal symptoms. We will soon have a workshop on H. pylori, so we will learn, won't go into details, but this is very important, cancer risk. And I'll share with you guys, as my clients know, and I'm so grateful for them, they helped me when my brother-in-law passed away this February. It was very fast. He has stomach cancer. But let me tell you the whole story. So he was diagnosed in November last year. I was home with my family in October. He was not perfectly fine, but sort of. Blood pressure and things like that, which we prescribe to aging, which is not true. And in November, he started, beginning of November, started noticing dysphagia, meaning difficulty swallowing. He went to his GI doctor, out of pocket. He didn't do anything. I don't think so. He, of course, what he did increase his PPI dose. Yes. End of November, he had endoscopy cancer. No, February he passed. But now, when we think back, he had a lot of heartburn. He had a lot of throat cleaning. And unfortunately, in Serbia, you cannot do those functional tests. You have to go to other countries. It's complicated. And I think so many times, guys, all the red flags along the way were present, unfortunately. Yeah. So I'm telling to you this not to fearmonger, just it can be serious. And I guarantee with my life, if we will do a GI map test, we will find overgrowth of H. pylori and maybe the virulence factors present that frequently goes with cancer. So that is, guys, that is, I can't emphasize enough, guys, test, don't guess. So what can happen? For example, in the case of my brother-in-law, I hope he's watching me and proud of me talking about him to wake up other people. And you know, guys, you cannot treat your family members. You know that, right? It doesn't work like that. I tried. So he was on, I think, pantoprazole, and it needed to be increased. So every time when he was complaining, the higher dose and higher dose and higher dose. I don't even remember last time. Hi, Jenny, welcome. How much, what was his dose? So especially here when we can do those testing, guys, and especially when we have, thankfully, Rupa Health, we can have payment plan on testing, which is fantastic. It's unacceptable to mask the symptoms of stomach, of heartburn, and don't do the testing, guys. That's unacceptable. H. pylori especially, H. pylori hates acid. So it will create urease and many other enzymes that will suppress acid production. So H. pylori can increase reflux. So this is the picture. Remember the sphincter is a lower esophageal sphincter, the upper picture, you see it's closed. Now when it's open, the content of the stomach goes up into the esophagus, causing that pain. Here, you see the esophagus mucosa and see the stomach, thick, 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 and thick layer of acid. So here you can see again, you know, it's open, and that little bit of acid, this is not, we don't have, low acid is not this much, will go up into the esophagus, causing that pain. Now, how can we diagnose, if you ask? So a couple of tests. We can start, let's start with the lower part. We can do a Heidelberg test, you know, the capsule when you swallow and they measure the pH. Then we can do endoscopy and checking what is visible. And usually they take biopsies, but here is the problem. For example, someone with gastritis, they take the biopsy, they find, of course, the regular pathology of the gastritis, inflammation, all that stuff. But many times they don't find H. pylori on biopsies. I have one client, she's not here with us. I have one client who had symptoms of, a lot of symptoms, severe symptoms of heartburn, and putting, I think she was on omeprazole, not sure, PPI. And high doses, I think she was taking 2 times 40 milligrams, I believe so. And they were putting her about every 3 to 4 months on gastroscopy with deep biopsies. And she was complaining their biopsies were so painful, she needed 2 to 3 weeks to recover from them. And last time when we talked, actually we talked once, and I know, guys, it's not easy to decide, to be out of pocket cost. She said, oh, let me think, let me think. That's fine. Guys, I don't take that anything as negative or, oh my God, she didn't sign up with me. I send out everyone with my blessings and tell everyone when the time is right, come back to me. You know where to find me. So she came to me in tears. She messaged me, can we talk? I said, sure, schedule. She said, no, right now. Okay. Sometimes I have a little bit of time, sometimes even with guys when it needed Sunday evenings. I know I should not be doing that, but I really deeply care about each and every one of you. So she said, I just had last week that deep biopsy. I'm still in horrible pain. I can't take this anymore. I said, let's work together. She signed up today. She's a long time ago. She's totally off of any PPIs, no heartburn, improved, not improved, optimized digestion. She's still with me because we work different things on aging. So yes, it is possible, guys. It is possible. Another story, not to fearmonger. I don't like fearmongering. Just to open your eyes, guys. Another story, some of you maybe even remember, I keep repeating things with a purpose. One of the very nice friend of mine, we connected in a business coaching group. And we started a conversation just to, to meet each other, to learn about each other. And he said, I have a horrible heartburn. Can you help me? I said, sure. And back then, that wasn't recently, I wasn't so adamant about testing. Now everyone has to test. And then he said, I'm afraid. First, he said his reflux is unbearable. He has a wedge under the bed. He has two pillows. Uh, every precautions. He still wakes up a couple of times because of the burning pain. I think he was taking 40 milligrams twice a day or even high, very high dose. But when he said, sometimes I'm so afraid my father died of stomach cancer. Could I go have the same fate? Then I said, you know what? I'll help you, but only if you test. Otherwise, no, I'm not even starting. Sure enough, he had H. pylori with both virulence factor. If you remember the GI map test, KG and BABE, those are the two virulence factors that are most frequently associated with stomach cancer. See? I could help him without the GI map, but no. And later on, of course, we learn as we progress. Now everyone has to go through testing if we really want a real root cause. So endoscopy, esophageal manometry, when they check the pressure in the sphincter, ENT, ear, nose and throat specialist to check the vocal cords or ears. Then we have a beautiful baking soda test, and I did that so well, guys, and my Facebook was taken down. I lost everything. I will repeat it, promise. So very simple. First thing in the morning, without drinking water, tea, anything. You take about 1/4 of a teaspoon of baking soda, mix in a small glass of water, say, I don't know, 4 ounces, drink it. Then you set your phone, the timer, and observe when the burp is happening. If it doesn't happen between 3 to 5 minutes, stop the timer. You have very, very low stomach acid. Sometimes people are confused. They expect some huge burp. Sometimes just a little air bubble is a sign. Then I tell them, do it 3 days in a row. But usually you don't need to do. Very simple, no side effect, no money, because most people have baking soda at home, right? And water. Now you can do the steak test and beta in HCl challenge. Steak test is usually when we dose the beta in HCl. So eat a steak and observe how you feel. So next day, eat the same amount of steak and add 1 capsule of beta in HCl, then 2 capsules, all the way until you feel the burning pain of stomach of acid reflux. And that means we have to cut back one capsule. Usually, most generally, people do very well with two capsules. That's most frequently. So now, if someone has severe gastritis, acute form, ulcer, erosions, forget it. Absolutely not, because you will have a lot of pain. No, it's not it. You can do it. And beta and HCl channel 2 of them are very different. So if you don't know, maybe you have silent reflux, say, and you don't know, is that low stomach acid? Or you're just curious. You take beta and HCl, one capsule, and you feel burning sensation, that means you have good stomach acid. Forget the whole story. It's not for you. So those tests are very simple, but very, very helpful, guys. Let me tell you. Now, here are the solutions. Bottom line, the main teaching from this workshop, guys, is how we get rid of stomach acid by restoring the stomach acid level in, no, how do we get rid of reflux? By restoring the stomach acid levels in the stomach. That's the ultimate goal. It takes time, different for everyone. It can be a couple of months, sometimes even a year. People have different background. People have different level of stomach acid or low stomach acid. So usually the beginning phase is slow. And once we get used to it, slowly the body will adjust and then go quickly get to the other side of the bridge. So our ultimate goal is to restore stomach acid. Now, sometimes doesn't go so easy or not so simple. We can start with the eating hygiene, absolutely very slow, sit down and slow down and chew well. Don't drink too much water during meals. Then we can add bitters. Bitters will stimulate the stomach, the parietal cells to start secreting stomach acid. Sometimes digestive bitters before meals will be helpful. Let me tell you guys, again, do not go on your own. Some people are so sensitive that they cannot even half of the dose of bitters. They have to go drop by drop. Start with one drop there and one more drop later on. And yes, so do not do things on your own. Now, if the person can tolerate bitters, then we can try a little bit increasing acidity, meaning adding apple cider vinegar or lemon juice. How much? Half a teaspoon. And see how do you react, and slowly build up tolerance. Then again, when the person is ready, we do beta and HCl with digestive enzymes. Now, licorice chew, mastic gum chew, very helpful. Fresh ginger. I remember a story. I haven't met him. My great-grandfather. My grandfather used to tell me stories. He will, after every meal, he would chew a piece of ginger. And I don't know, my grandfather didn't. I don't know why. I think we became modern and, I don't know, but he said the house could not be without ginger. And I'm all like him. My house can be, if not fresh ginger powder, it has to be, because I feel I'm addicted. So yeah, after every meal, piece of ginger. Yeah. So baking soda, guys, that temporary relief. Baking soda is not for long term, absolutely not. Chewing gum, did you know when we chew gum, we create more saliva, and that is calming for the stomach acid. And we know that elevated bed, wedge under the pillow, walking after meals is very helpful. 15, 30 minutes walk is very, very helpful. So here we have gastritis, we have tumor, and peptic ulcer, the localization. And guys, Australian doctor, Dr. Barry, and what was his other name? I forgot. They got Nobel Prize for proving that H. pylori is causing ulcer, because they drank guys, I'm very passionate about what I do, but I didn't reach that level yet. They drank culture of, I think, Dr. Barry, of H. pylori, and they did endoscopy on them. He did on them himself, proving that his gastric mucosa is healty. Then he drank the culture and later on did the endoscopy, proving that he has ulcer because of H. pylori. And then he administered antibiotic for himself to clear H. pylori and prove again that his ulcer healed. Again, I don't know if I could do that, although crazily love medicine and what I do. So, and they won a Nobel Prize, yeah, proving. Because again, that was in the 90s. I was taught in medical school that stress and too much acid is the cause of ulcer. No. Now, I forgot to mention, guys, the diets. Yes, avoiding food, absolutely. If you know that chocolate, if you know that coffee or whatever is making reflux worse, of course you will avoid in the process of healing. It's not for forever. I know, and guys, please take it on the right way. The acid watchers diet is absolutely a great diet, very helpful, but that's only a temporary solution. You cannot be an acid watchers diet for forever. No, that is to help you until you figure out what's going on. And you stopped. So acid watchers diet is a big help, but it's not root cause medicine because you stop the diet. What happens? Reflux, right? Because we don't address the root cause. So uh, now antacids, I could not talk about this. My workshop won't be complete because it's so important, guys. So many people. I didn't pull latest statistics because I want to do a workshop only on this because so important. Guys, I used to lecture a lot before COVID, live lectures, workshops, sessions after Q&A. And when an older person will come up to me with canes and, limping, and they say, oh, I just had a hip replacement, whatever. What happened? I broke my hip. I just turned suddenly, nothing, no fall. And I said, now I learned, are you on PPI? Sure enough, 95%. Yes. Yes, guys, it's bad. It's bad. Again, remember, PPIs have their role, absolutely amazing medication for 2 to 3 weeks. That's it. Then we have kidney disease, we have mineral deficiencies, all the mineral, bone fractures, yes, because of low minerals, vitamin deficiencies, headaches, diarrhea, immune system impairment, dysbiosis, SIBO, and dementia later, cancer risk highly elevated. So a lot of side effects, guys. We will have a workshop to cover all this. And here is, I like to share these pictures. We have to realize that, again, as I shared last week, what is beyond bloating? We can manage bloating. We can manage reflux, taking omeprazole, right? Perfectly will clear the symptoms. But what is happening behind? That's the question. So, and the digest framework, I just came up recently with this one, and I'm so proud of me. So here is the digest, basically the digest framework we can implement to every gut issues. So the D stands for discover. What is the root cause? What is happening? Is that low stomach acid most frequently? Is that fermentation? They go hand in hand. Is that H. pylori, right? Then we remove the triggers. We need, of course, guys, no one is telling you that we are working on restoring stomach acid. We have dealing with a lot of heartburn, but oh, just keep eating chocolate. No, we remove it. We have give the body a little bit of ease, right? Then generate support. We give the digestion what digestion need. Then we empower repair, heal the gut lining. Then support the microbiome, seed and support the microbiome, and transform and thrive. Reintroduce food and enjoy your life. I think this is it. Oh, for everyone, guys, you don't have to write down. I'll place it in the group. It's a soothing reflux tea recipe. Chamomile, marshmallow, licorice, and fennel seeds. Again, don't have to write down. Don't worry. I'll put the whole recording and I'll put separately the tea recipe. So, and I believe this is the end. Questions. Let me scroll and see if any question. Alita, is the baking soda test safe for someone with a heart stent and watching sodium? Yes, it's just a quarter of the teaspoon. It's so small. Yes, yes, absolutely. Any more questions? If not, this is the time to say goodbye. Thank you, everyone, for joining me. So the choice is yours. What are you going to do? Are you going to start searching what is the root cause, or are you going to take PPIs or H2 blockers and mask the symptoms of stomach acid? So let me see. Alita say, acid watcher's diet has two phases, healing and maintenance. There are many approved foods on maintenance. Most of the restriction on maintenance are processed foods. Oh my God. Oh, but I have been for years, I'm not able to get on maintenance. I'm not able to stop. Yes, this is why. Hi, Jerry. I didn't see you before. Oh my gosh. No, it's so great to see you. So, yes, that's just proving what I just said. Acid watchers diet are a fantastic tool, but it's not root cause medicine. It's not root cause medicine. Slippery elm, guys, everything that coats the mucosa, slippery elm, DGL, licorice, right, is very helpful because it coats, it creates, or aloe vera juice. Even just making aloe vera water will help to coat the mucosa, yes, and lower the irritation. So I would, Juana, I won't recommend that every day to take baking soda. No, no. Now, if you have a lot of reflux, you might spray a little bit in your throat before bedtime, but I would not rely. Baking soda is just temporary, quick relief. That's it, not on daily basis. Any more questions, guys? So as soon as I upload the workshop, I'll place in the group and everyone can watch it later on, rewatch it if you want. And I think so. Yes, the thank you slide. Really, guys, thank you for everyone who joined us this evening. Have a wonderful day. And if you watch the reply and have questions at all times, you can a week later, month later, ask question. Just please tag me because I easily can miss your questions. Happens so many times, guys. You ask questions, don't tag me. I didn't see it. I'm not notified. And later on, maybe a month later, I scroll searching for something. I see, oh my gosh, I didn't answer this question. This, oh, so tag me. That's the best way. That hopefully, with high certainty, I will see that question. So baking soda spray, yes, that's okay, but not drinking baking soda all the time. Yes, you are so welcome, guys. Have a beautiful evening, everyone.